Now, toxicologists have warned against the use of organophosphate chemicals in households following the deaths of 6 children in Naledi last month from eating contaminated snacks. The chemical responsible was identified as an organophosphate though authorities are still investigating how illegal pesticides are reaching townships. We've roped in Dr. Kobus Pretorius, medical doctor specialising in clinical pharmacology, to help us understand organophosphate chemicals and what are they and the dangers they pose. Doctor, thank you so much for your time. Appreciate it. Let's just start first because, I mean, it does seem like from what we've been hearing from the minister, from a number of officials in this regard, it is a group of chemicals. Organophosphate, it's not one, but it appears to be a group of chemicals. Are we correct?
Good afternoon, Bongiwe. Yes, you are correct. It is a group of insecticides that's used quite commonly in agricultural purposes, so in farms. But unfortunately, like you've mentioned, accessibility on the streets it's a problem. People use it because it's effective and it's cheap. And unfortunately, children that will ingest some of the foods that's been contaminated then will present clinically with having poisonous symptoms. So it is quite significant that we need to make the public aware, and that's why I think this is important that we talk about this important matter.
And as we speak right now, we're seeing visuals on screen around, a spaza shop. We're seeing items now being placed, of course, in shelves. One wonders, because when you think about the children in Naledi, and we now know, as the results have, presented, that organophosphate chemicals were involved. Let's talk about the storing of these particular, shelves. You find that in some of the instances, there's food on one end and what appears to be chemicals or other things on the next side. How important is it that when it comes to some of these stores, things like that are kept far away from the shelves as far as possible?
It's extremely important, and as well as to label the products that is bought, I think sometimes individuals will buy insecticides from, like you've mentioned, from spaza shops and not actually knowing it's organophosphate. So they would actually, the intention would be to buy it for rat poison and thinking that it will kill the rodenticides, or it's a rodenticide, but then it is actually organophosphates. And like you've mentioned, it's over crops, and if it's not thoroughly washed, it can be absorbed. And the issue is, when it comes in contact with your skin, it gets absorbed. So not necessarily maybe the product hasn't been washed. So we've had a couple of incidents in young children who were exposed. Maybe mom or dad was working in an agricultural environment and did not decontaminate themselves, and they were actually exposed because of the dermal absorption. So I think the issue sometimes is in these shops, they probably use it in a spray formation to make sure that there's no rodents, and then you buy some of the food and you touch it with your fingers, and maybe it's a packet of chips, and then you ingest it without knowing it, and then you present with symptoms of nausea and vomiting and feeling unwell. And especially young children are more vulnerable because of just the fact that they are quite young and they ingest far more dose-wise compared to adults. So it's a significant problem. So,
Dr. Pretorius, there's something that you just said now, especially around the killing of rodents, because it is something that we have been hearing about. But there's another concerning chemical, that's Aldicap. That is right now quite dangerous, and there are concerns about how it is now even flooding the streets. Where does it fall under?
So it's also organophosphate, and I think that's the problem. It actually looks like black little granules, and I think you can buy it quite in bulk, which is a problem. So the accessibility, you're supposed to sign for it in a register, so we're not sure if it comes from our neighboring countries. So that's why we're trying to do what we call is toxicovigilance, to try and figure out exactly where does this come from in order for us to put things in place. But usually when you go to certain vendors and shops, you will find them on the street. it. It looks like in straws. They usually put it in straws. It's about 2 to 5 rand, so quite cheaper than the normal rodenticides that you have to pay for in the supermarkets. And it's highly effective. It works very well. So if you've got a problem with rodents, people buy it because it works effective, but not actually knowing that aldicarb, which is an organophosphate, which can then present with patients having difficulty in breathing. They can have seizures, which then requires admission in hospital, being ventilated. And if you don't get treatment, you can die because of the complications. And like I've mentioned, it gets absorbed so quickly, and that is the problem.
Yeah.
And children, because it's in straws, it looks like maybe some other sort of snacks that are unaware of, because it's unlabeled. So there's no label on it to say it's dangerous because it gets decanted from a big bulk buy. So I think that's another problem that we have.
And I suppose it speaks broader then to the issue of regulation, that if you're able to purchase something like this, in bulk, it is not supposed to be flooding the streets. We do need stricter regulations because the list is there, but very little is known about the list of these pesticides that are not supposed to be used, and members of the public, a lot of them still don't have access to it. So certainly regulation is needed in this particular regard.
Definitely. I think there is a lot of regulations in place, but the enforcement is the problem.
Yeah.
So, and I think that's the issue. So I think with a lot of other issues that we have, and I think education is important because, I think as a member of public, you're not always aware of what you buy, especially if it's unmarked, unlabeled, and not being communicated to you, and it works effective. So I think that is the important thing. And once you have symptoms, it's quite significant, prolonged hospital stays. So if you think about the cost that it also costs, I don't want to talk about cost, but I mean the money that, let's say, government would have spent to treat one patient in hospital, you can potentially use that for labeling products and enforcing some of the regulatory things that's supposed to be in place. So it's a big problem, unfortunately. But I think what you are doing, Bongiwe, just to discuss and to make individuals aware, it helps significantly. And I think this is the way forward in educating individuals.
And definitely education is needed. Dr. Pretorius, appreciate your time. Thank you so much for joining us this afternoon. And it certainly does help, with the viewers understanding a lot more of what they are being faced with and what they should know when it comes to what they purchase. That's Dr. Kobus Pretorius there, who is the medical doctor specializing in clinical pharmacology.